So what are intra-articular injections for shoulder pain? Well, shoulder pain, one of the commonest causes is arthritis or wear and tear of the shoulder joint. Like all joints, the shoulder joint is between two surfaces of bone. You have cartilage, and with the arthritis you can get a thinning of that cartilage and you can get fissures or splits, and sometimes the cartilage comes off completely and you get little loose bodies. How does that translate? Well, patients have shoulder pain. It can be a deep aching pain inside the shoulder. Sometimes it locks, can be very unpleasant and can be extremely limiting in their activities, their normal daily activities. Now, when presented with a patient with shoulder pain, we will always do a thorough assessment. So we'll see the patient face to face, we'll take a history from them, find out all the characteristics of the pain, and we'll do a targeted examination of the shoulder joint. And then we will look, do we need any investigations, which will usually be an MRI scan of the joint, sometimes x-rays, but generally an MRI scan. And then we can come up with a diagnosis. Now, if patients do have pain in their shoulder joint, which is related to arthritis, there are a number of different treatment options. Some of the most conservative options tend to be medication-based, and they will be painkillers, usually anti-inflammatories, weak opioids, codeine-based medications and others, followed by some physiotherapy, and that will improve the vast majority of patients. Now, from there, the next step is if patients fail to improve with these conservative treatments or not getting any better or have persistent pain, then we may consider what we call minimally invasive pain management procedures. Now, in the case of the shoulder joint, we can look at what we call intra-articular injections. These tend to be X-ray guided or ultrasound guided procedures where the shoulder joint is identified and then an injection is done into the joint, usually of local anaesthetic, and it can be mixed up with a variety of substances. One of the substances that we use a lot is cortisone preparation. This particular one is called depomedrone. We also use triamcinolone and others, but these are the major ones that we use. And essentially this is a steroid preparation, but it is in a crystal form, so it will tend to stay inside the joint, and it will provide a reduction in inflammation and a reduction in pain. Now, sometimes, rather than injecting steroid, we may choose a different substance to inject. Now, these are globally referred to as viscosupplementation or viscosupplements. And essentially what they are is a synthetic form of the fluid that is found within the joint itself, which is formulated into a preparation which is manufactured essentially and then can be injected. Now, I've brought one with me here. This one is called Synvisc, Highland GF20, but Synvisc is the name of it. There are others. There's Durolane, there's Ostenil, and there's just hyaluronic acid on its own. So there are a number of other preparations that are used. What do all these preparations have in common? Well, essentially it's thought that once they're injected, and they're very, very thick, these substances, they're like a sort of jelly-like substance. Once they're injected into the joint, the first thing that happens is they provide a physical barrier inside the joint. So they actually essentially, physical barrier, stop. Okay, I'm going to start again from physical barrier. So what do these substances do? Well, essentially, when they're first injected, they create a physical barrier, this thick jelly-like substance inside the shoulder joint. And that will reduce the inflammation on either side of the joint, in the ends of the bones on either side of the joint. So that will provide pain relief fairly quickly. The next thing that happens is it is thought that there are properties that the viscose supplements have, which will promote the joint to produce more hyaluronic acid. That's the fluid that's already in, or sorry, synovial fluid, which is the fluid already in the joint, and to also allow, to a certain extent, some regeneration of the cartilage which is already in the joint itself. As with all these procedures, the benefits: pain relief, takes about 10 to 14 days to work, sometimes less, sometimes more. Again, the procedure is done either under ultrasound guidance or X-ray guidance. The risks of the procedure are failure, local bleeding, bruising, infection, discomfort. One of the issues with viscose supplements is if the viscose supplement leaks out of the joint or is injected not in the joint but around the joint, it can be extremely painful. It's very irritant to the local tissues. The way in which we get around that, as I mentioned before, is we would tend to do these procedures either under X-ray guidance, or increasingly we can image the joint under ultrasound. We can actually see the joint itself, and then we can put a tiny little needle into the joint.